Can you just kind of briefly let us know what are the state requirements for assisted living versus memory care?
So if you're thinking about assisted living and memory care, those are one and the same, so to speak, when it comes to how they are surveyed and rated for what they can accept, right? So how they're rated. What a memory care unit has on top of assisted living is extra requirements around education for the staff, a difference in their staffing ratios because of the increased need care level. Their staffing ratios are going to be different. But memory care in and of itself is an assisted living level of care with that extra layer of requirements and education for the community and the staff. I think what's important for folks to understand too is what is the threshold, potentially is that cutoff point of where someone is no longer going to be qualified for assisted living or memory care. And as the state defines it, if you have a greater stage 3 or greater wound on your body anywhere, so skin breakdown that progresses to a stage 3 or greater, if you require tube feeding, if you require IV infusion, if you have a trach, if you need a fluid restriction, those are some absolute black and white rules that have to be met. And that is a threshold that an assisted living community just has to say no. Now, within that mobility range of what level of mobility an assisted living community is comfortable taking, they can define that themselves. So an assisted living community can say, or memory care community can say, we will not accept a resident if they're more than a one-person assist.
Mm.
So it takes more than one caregiver to assist them with a transfer from the bed to a chair. Then the state doesn't say that. That's the assisted living community making that decision. Our assisted living communities do a really good job of managing dementia as long as they can, right? And to your point, when those safety concerns of being a wandering risk or just not being able to socially function in a way that's appropriate for assisted living, then yes, those are definite thresholds of at what point would you need to advance from an assisted living, perhaps unsecure assisted living setting to a secure memory care setting.
Yeah, and I will add to that as well, depending on the community, they all kinda have their own rules and thresholds,
Mhm.
but, if folks start requiring a lot more prompting and cueing where they would just benefit from that higher staff ratio, sometimes that can be a discussion as well about potentially transitioning from assisted living to memory care.